Hi, I'm Tom Myers, and I'm pleased to welcome you to this program with soft tissue techniques for the shoulders and arms. These techniques are organized in terms of the Anatomy Train's myofascial meridians. Anatomy Train's principles and methods are outlined in the book and in the earlier programs that we've done in this series, especially the front, back, lateral, and spiral lines. You might want to watch those first. These educational programs are designed to expand your skill as a practicing manual therapist. Please use these techniques responsibly. You can certainly enhance the successful application of these techniques by attending classes, such as those we offer at Kinesis. But, based on our previous work, experienced therapists will find it easy to apply the many techniques that we've put forward here in daily practice. In this program, some of the techniques are simply demonstrated and explained for you to follow. Others, the more variable, difficult, or open to misinterpretation, are first demonstrated and then taught to a student. That way, their questions, the comments of the client, and my corrections all become part of your learning. Now, the best results come from applying these techniques in a sensitive and listening manner, linked with the client in an unbroken rapport. Many of these techniques call for the client to be moving while you're working. This client moving is an essential part of our myofascial technique and should not be neglected. These techniques should create the feeling of tissue stretch and tissue opening in the client, but they should not be applied if they're painful or if the client is trying to flinch away from what you're doing. We do recommend the other programs in this series to supplement these techniques. The techniques evolved in the front, back, lateral, and spiral line programs create the spinal and ribcage support necessary to full shoulder and arm use and movement. The subsequent programs in this series, the functional lines and the deep front lines, extend this work into further areas of the body. We hope you enjoy and have fun learning from these programs. Good luck and good skill. Your shoulders have written within them a strange and complex history of adaptation to changing circumstance. They started as pectoral fins on the earliest fish. We presume that they moved forward so that when the first land creatures started to move around, these fins helped them switch through the mud. The fins helped the side-to-side motion of the spine be more effective in motivating the creature over the land. The first four-legged creatures had the arms well out from the body like this. They were certainly more effective at allowing the creature to motivate, but they couldn't hold that belly up off the ground for long, like an alligator. As the legs moved more and more under the torso, the familiar four-footed creature appeared, and their use of the shoulders was very interesting. They want their legs to be as close to the midline as possible. None of them have a collarbone. Us, we have a collarbone because we want to push our shoulders out to the side of the body. In this arrangement, the rib cage hangs in a sling, which comes down from the top of the shoulder girdle and is formed by the serratus anterior muscle. The rib cage floats in this sling back and forth, and this arrangement is designed to carry much more weight than the pelvic girdle, which is, in fact, designed to push, run, or jump. Closer down our branch of the family tree are the arboreal apes and monkeys, who use their shoulder in an entirely different way, i.e. hanging from a branch. And they were using the shoulder in tension to support the body rather than in compression. So the arm lines that we're about to study come down the arm here and then connect into the rest of the lines of the body, connecting that musculature into the pelvis and the legs, which is a good idea when you consider the forces involved in those wonderful flings from branch to branch. Finally, in our own unique case, the shoulder drapes like a yoke, half resting on the rib cage, half hanging from the neck. The object of the techniques we're about to learn is to find and maintain that balance where breathing and movement can happen under the shoulders and everything works well. In fact, assessing breathing can help tell us where to work on the shoulders. In proper breathing, the shoulders move up and out on the rib cage on the inhale and down and in on the exhale. If you see this motion with the shoulders moving out and up on the rib cage as the rib cage moves underneath them, then the shoulders are probably positioned pretty well. If, on the other hand, you see the shoulders going straight up and down with the breathing, straight up, straight down, then you can be pretty sure that what you need to work on are those myofascial structures that hold the shoulders to the rib cage. They're too held to the rib cage. In a third instance, if you see somebody breathing and the shoulders hardly move at all, even when they take a deep breath in, you can be pretty sure that what you need to work on are those muscles that hold the shoulder from the neck. We'll be parsing these out individually as they come up, but this assessment can help us know where to work. It's a complex job to support the shoulders properly on top of the rib cage, involving the lumbar spine, which can be too far back or too far forward for good support of the shoulders, and the rib cage, which again can be too far one way or too far the other to keep the shoulders well supported. Then the shoulders themselves, they could be positioned too far back, posterior shift, or too far forward, an anterior shift, or they could be rolled over the rib cage in an anterior tilt. And I don't very often see a posterior tilt. And of course, that's presuming that the two are the same. Very often, one could be slightly different, one forward and the other back. You have to look to see. The only place that the shoulder touches the axial skeleton is right here at the sternoclavicular joint. This shallow saddle joint allows a circumductory motion, which you can feel if you put your fingers here. If you walk out along the clavicle, you'll come to the second shoulder joint, the acromioclavicular joint, which is located about 1 inch in from the tip end of the shoulder, here. The scapula is a wonderfully complex bone that starts here with the acromion process and travels backward with the spine of the scapula to the vertebral border, where it spreads wide, gathers in all these rotator cuff muscles, and comes right out to the glenohumeral joint, joining to the humerus. And let's not forget this little bit of bone that sticks through from the back, a little thumb or crow's beak called the coracoid process, which you can find right here. The humerus is pretty hard to feel at the top because it's covered over with a deltoid, but the two epicondyles, the medial and lateral epicondyle, are very easy to feel at the bottom of the arm, as is the olecranon of the ulna. The ulna can be traced all the way down the outer arm to the styloid process at the wrist. The radius and the ulna have a complex joint in between them, consisting of a joint here, and the interosseous membrane in between the two. Notice that the radius is bigger at the lower end, so it's the radius that really interacts with all these carpal bones, and of course the carpal bones go to the metacarpal bones in the hand. As you know, the carpal tunnel is right on that side of the hand. Now, it may have struck you, as it struck me, how similar the arms and legs are. Even though they developed at different times in our history and for very different purposes, they are both constructed on a 1, 2, 3, 4, 5 pattern. If you look, you can see they both start with ball and socket joints. They both have one bone in the upper part of the limb. They both have two bones in the lower part of the limb after a hinge joint. And look, it doesn't stop there. The arm goes 3 carpals, 4 carpals, 5 metacarpals. And you know the leg is the same. There's 3 bones in the subtalar joint, and then 4 cuneiforms and a cuboid, and 5 metatarsals. I don't know why they don't teach this in anatomy classes. 1, 2, 3, 4, 5. Makes it simple to remember. There is one big difference, though. The arm is designed for mobility over stability, and the leg is designed for stability over mobility. It means it's easier to stand on your legs and wave your arms rather than the other way around. Just before we get to the lines and the techniques, we need Jeremy's help to put one more central concept in place. Scapular position, as we were showing before in assessment, is essential to the good positioning of the shoulder. With no joints between the scapula and the rib cage, the scapula is free to roam around back here. So the stability is provided by a series of muscles that form an X across the scapula and keep it in place. So let's go explore that X. The techniques for each of these different muscles will show up with their particular lines, but we need an overview first. One leg of this X is formed by the rhomboserratus muscle. That isn't a real name, but it might as well be. The rhomboids and the serratus anterior together form one fascial sheet that goes from the spinous processes around to the lateral ribs, and the medial border of the scapula is glued into the middle of it. It forms part of the spiral line. So now if the rhomboids part of this pair is too short, the scapulae rest too close to the spine, and this is very common in folks with a flat back position. If the serratus anterior part of this pair is too short, the shoulders tend to be protracted away from the spine, and this is very common with people with a kyphotic pattern. So you want a balance in this X that allows the shoulder blade to rest in between and the back to be in a good position underneath it. You'll find techniques for the rhomboids on this program in the section on the deep back arm line, and techniques for the serratus anterior on the spiral line program. Now, half of the other leg of this X is formed by the lower trapezius, which is the only muscle to pull down and in on the scapula, in the style of military posture or Shavasana in yoga. So what muscle could oppose the lower trapezius? It would have to be up here, pulling like this on the shoulder. There's no muscle like that. In fact, though, there is. It's just that it pulls down from the front. There's an essential antagonistic relationship never described in the kinesiological literature, as far as I know, between the lower trapezius pulling down like this and the pectoralis minor pulling down like this. Okay, now seldom is the lower trapezius too short and the pectoralis minor too long. But way, way, way too often the pectoralis minor is too short and the lower trapezius is too long. This brings the shoulder into protraction, into an anterior tilt, and you can do things like hold the ribs forward to change it, but many, many times this needs to be open. Therefore, the pectoralis minor section of this program will be disproportionately long because this muscle, this fascia, this area is so important that we really need to have a variety of ways to open it and to make sure that we get it very thoroughly. These pec minor techniques can be found in the deep front arm line section of this program, and strengthening techniques for the lower trap can be found in the superficial back arm line section and also in the functional line program. But in short, getting the rib cage up under the shoulder girdle and balancing this X on the back of the scapula are great ways to get started and to set the shoulder up for the arm techniques that will follow it. I know. When are we going to get to the techniques? Just one last thing before we get there. Let's take an overview of the anatomy trains lines. There are 4 myofascial meridians in the arms, all leading from the axial trunk to the tips of the fingers. They're named for how they are arranged in the armpit. If we look at this sagittal section of the armpit, we see the pectoralis major as the frontmost myofascial layer, so we call that line that proceeds out from there the superficial front arm line. Deep to this, but still in the front of the axilla, is the pectoralis minor, embedded in the sheets of clavipectoral fascia which run from the collarbone to the armpit, and includes the subclavius muscle as well. This is the beginning of the deep front arm line. In the armpit itself is the neurovascular bundle, including the brachial plexus, lymph nodes, and blood vessels. Behind these vital tissues lie the scapular sandwich, the thin scapula, surrounded by the muscles of the rotator cuff. This complex is part of the deep back arm line. And finally, the most superficial in back is the trapezius muscle, the origin of the superficial back arm line. Although the arm lines are arranged in this linear fashion in the shoulder, they pass down the upper arm and lower arm like a quadrant, so they end up in the 4 corners of the hand, down to the thumb, down to the palm, down to the back of the hand, and to the little finger. Another interesting thing about the arm lines is that they alternate muscle, fascia, muscle. The superficial lines, that's both front and back, start with big muscular elements near the rib cage that goes into fascial elements in the upper arm, muscular elements in the lower arm, and fascial elements in the tendons of the hand. The deep arm lines, that's front and back also, start with very fascial muscles close to the rib cage, go into great big movable muscles in the upper arm, turn into fascia in the lower arm, and then finally end up with a muscular element in the hand. By tracking these alternations, the arm lines alternate between stability and mobility. Finally, we should note that even though these arm lines are very clear and linear from shoulder to hand, there are in fact several crossover muscles that that join one line to another. And these are used because the arm is so mobile and can get into so many positions that you need these crossover muscles to provide the stability for the arm to get in all these positions. And here's a simple example of one of these crossovers every time you pick up a suitcase. It's the superficial front arm line with the flexors that's actually taking the weight of the suitcase, but that's transferred via the bicipital aponeurosis to the biceps, part of the deep front arm line. That goes up to the coracoacromial ligament and across to the trapezius, which is part of the superficial back arm line, and thence on up to your head. In this way, you can induce a headache by one-sided carrying. Now I know the anatomy of the arms is complicated, so here's a simple way to remember how the arm lines relate. If you stand with your arm out and the palm facing forward and the elbow facing down, then the superficial front arm line is laid out along the front of the arm. Pectoralis major, the intermuscular septum in the upper arm, the flexors in the lower arm, the tendons in the palm. If you turn the arm so that the elbow faces back and the palm faces down, then the pectoralis minor and the biceps of the deep front arm line, along with the edge of the radius and the thumb and its attendant muscles. It's laid out. It's an easy way to remember it. Similarly, in the back, if you stand with the palm facing forward and the elbow facing down, the trapezius, the deltoid, the intermuscular septum, and the extensors of the superficial back arm line are on the back of the arm. But if you now turn at the shoulder so the elbow points back and the palm faces down, then you see the rhomboids, the rotator cuff, the triceps, and the back of the ulna leading to the little finger and its muscles. Works every time. This idea leads to assessment stretches for the arm lines. If you turn the shoulder into a lateral rotation and let somebody really lean into it, they'll get a nice stretch for the superficial front arm line, and often will feel it in the pectoralis major, in the septum in the upper arms, or in the flexors in the lower arms. Conversely, if you do a medial rotation of the humerus and let somebody really lean into it, they're much more likely to feel it in the biceps, in the pectoralis minor, or down the inside into the thumb. Although the back arm lines are pretty well stretched out from the fact that we do most of our work in front of our body anyway, you can get a similar deal out of the back arm lines. If you give the humerus a lateral rotation and they lean back into it, most folks are going to feel that in the trapezius, the deltoid, and in the extensor group. Conversely, if you turn the humerus into a medial rotation and they lean back, most folks will feel that more in the rhomboids, the rotator cuff, and the triceps. You can ask them where they feel it, or sometimes you can feel it. In any case, that may help you as to where to work in the arm lines. Okay, we're done with the introductions. Let's go on to some techniques for the superficial front arm line. So the superficial front arm line starts with the pectoralis and the other muscles, comes down the inside of the arm to the medial epicondyle, gets onto the flexor group, and ends up on the palm side of the hand. Okay, so we have Stefan here to help us with the superficial front arm line, which is where we're going to start. And the first structure, the most proximal structure, is the pectoralis major muscle and its attendant fascia. And though it's possible to work that from here with the arm down, most of the time I do this work with the arm up. It unfolds the muscle and presents it very well for you. There are really three parts and one technique to go with each part. There's the lower edge, the middle, and the clavicular portion at the upper edge. So let's start with the standard part of it, the middle, coming straight out from the breastbone out to where it ends on the arm. Now, in opening this up, which is what we're trying to do here, although this bears a resemblance to muscle stripping, we're not. We're opening the fascia on this muscle. And to do so, we want to move into the tissue and very slowly feeling the tissue opening in front of us. And the second thing is we want the client to be moving. So moving slowly at the tissue, at the speed the tissue opens, and allowing the client to move along with us to help that opening of the tissue. So how are you doing with this, Stefan? Is this okay?
It's very nice. I can feel the tissue melt.
Good. Okay, and he reaches up, and now I'm getting right to where the muscle ends on the arm. Okay, so I might do that several times, and while I'm here, since he has some hair on his chest, if you bring the hair back, you'll be able to do this perhaps more easily, or perhaps you need to use some lotion or something to soften the way here. The second part of the muscle you can actually see here on Stefan. It's particularly short, so I'm going to go in there and particularly open that particularly short part. Here is where the pectoralis comes across the clavicle here, and very often right there, boing, boing, you will find a very short part of this myofascial unit that we would like to open. So I get my fingers, I'll just show you this for the camera, but then I get my fingers right up into and under this portion of the muscle and open it. And again, Stefan, if you want to just let your hand travel up the table, opening this up. His movement helps me make the change in his body. Also tells me where I am, helps me know where I am in his body. Good. So another way to do this particular part, this particular horizontal part of the muscle that opens here, involves you moving closer to this edge of the table. Good. Even a little closer if you would. Bring your shoulder right over to this edge. That's good. And now we're going to use the fact that he's on the edge of the table. I'll lift up his arm to soften this tissue, and then he and I together, I'm going to pin this tissue here that I want to open, and then he and I together are just going to open that part of the shoulder. And the reason it needs to be near the edge of the table is so that it can open up like that. This is a really nice opening for the shoulder, particularly for people who have that tightness. I search around with my fingers till I've found that tightness, and then let the arm, or I can let you take it, Stefan, and just open it up. Try to put your fingertips on the floor. I know you can't get there, but that kind of direction. Wonderful. Okay, great. So now move over to your left again, if you would, so your arm can rest on the table. And that brings us to the third one here, which is this lower edge of the pectoralis. And I can get under here with my fingertips. I often put a hand on the top to reassure and keep it from being overstretched. This tissue is delicate, obviously, in the armpit, so I'm just going to move along that tissue 1 inch at a time, opening up the tissue on the back side and the underside of the pectoralis major as I move up here. And again, I take that all the way up to the arm. And you can also take your hand up here if you can bear it, stretching your hand up the table to increase that motion. Sometimes if fingertips are too much, you can just take the back of your hand and take a bigger piece with the back of your hand. That's sometimes easier for people to take. It's not quite as specific, but it will get you some of the way. Feel that one burning a little more, did you? Mm-hmm. Okay. Well, we won't do that again. Seems like that should take us pretty much through the pectoralis major. Let's move on to the intermuscular septum in the upper arm. To get the outside edge of the pectoralis major in a female, you do want to remember that the breast is supplied in terms of its blood supply and nerve supply from the armpit. So we go very carefully in under that muscle in order to open it up, and I'll have you do the same thing that I had Stefan doing, of reaching up with your arm while I'm hooking on the fascia on the underside of that muscle. If you have someone with large breasts, usually the client will accept the back of the hand against the breast as you hold it out of the way so that you can get in here. It's just a shame to miss these areas by being too shy to do them, but most clients have been living with their breasts for quite a while, so that if you treat them with respect and matter of fact, you'll get your work done. Following on from the pectoralis major, the next section of this superficial front arm line is this intermuscular septum that passes between the triceps and the biceps down to this medial epicondyle on the arm. If you strum just proximal to that medial epicondyle, you'll find a kind of guitar string, or a bass string really is what it feels like mostly. If that string is tight, then you can help the function of this arm line and open up the ability of the arm to widen by simply I'll just be really specific here, putting the two fingers on that string and opening it up. This usually doesn't require too many repetitions, just to soften this string just proximal to where it ends here on the medial epicondyle. And if we continue right on, from the medial epicondyle come all these flexors. So that are all leading to the fingers and carpals. And if you get, this is called the common flexor tendon, and if you get right in on here, you'd be able to open up these flexors towards the palm. So Stefan, if you could open your hand, open your fingers really wide towards the floor as I do this. Yep. So here you can see me doing this with my fingertips, using his motion. That's fine and relaxed. Or you could generally get this all with a hand, back of your hand, loose fist. Now open your fingers again. Good. How's that feel to you?
Very good.
Yeah. So there's two layers of these muscles here. There's a superficial layer and a deep layer. So to get the deep layer, I just need to drop down another layer. Is that okay?
Mm-hmm.
Yep. So now once again, open your fingers, and this time, yeah, that's okay. Close them and open them. And really pay attention to those fingertips, because these deeper muscles go down closer to the ends of the fingers. And open your thumb as well. Good. Okay. So several repetitions of both the superficial muscles and then getting down deeper to open up the deep ones, and the client is opening the hand and even taking the hand back towards the floor, hyperextending the wrist to stretch these muscles as you work them. So moving down from the flexor group, we get to where all those tendons run under the carpal tunnel. And the carpal tunnel is a very complex place, and we don't have the time here to explain it all. But the basic technique is to stretch and widen the flexor retinaculum to give more space over the top here. So if you put two knuckles, one at the base of the thumb and one at the base of the little finger side of the hand, and simply spread those wide. Now I'll show you with my fingers here what I'm doing. I'm simply taking these two bits. You can actually feel the bones at the base of the hand on either side, and you want to be between those two bones and spreading. But since it's very tough fascia under there, you really want to get knuckles and spread this wide. You should be aware that I'm there, but it shouldn't hurt very much.
No, it doesn't hurt.
Doing this. So you can put quite a bit of pressure on here and get this to open. If somebody's got carpal tunnel troubles, they'll be swollen and they might feel that a little bit more because of the swelling. But it still is very helpful to open this tissue wide between these 2 points. And finally, on this line, you can do the same thing pretty much with the palm. If you take, now I'm not taking the point of the knuckles, I'm taking this flat of this knuckle here, of this second part, and I'm going to ask you again to open your fingers against the table, Stefan. Yep. And you just take this palmar aponeurosis, which is the big sheet of fascia that comes across the palm, and yeah, open, that's great. Opening the fingers as I work, letting them close, opening the fingers as I work. Again, you can put quite a bit of pressure into here with most folks without pain and without disturbance. The palm is used to a lot of pressure, and we can get the whole thing open like that. This line starts on the ribs with the pectoralis minor, slides down the biceps part of the arm, and gets onto the radius side and ends up on the thumb of the hand. Hi, so now we're going to start in on some techniques for the deep front arm line, and we have Stefan here again to help us. The deep front arm line snakes out under the superficial front arm line for the most part, and kind of around it, we'll see. But it's definitely under it for this first part. We had the pectoralis major for the first structure of the superficial front arm line, and underneath that is the pectoralis minor, which is the first structure of the deep front arm line. And that goes from the coracoid process to the fifth, fourth, and third ribs here, so that's a much smaller muscle. But fascially, the fascia underneath it that's associated with the pectoralis minor goes all the way, again, from the collarbone to the armpit, same as pectoralis major. So If I have my everything's the same as everything else, you're all good New Age hat on, then I would say anytime you put your fingers underneath the pectoralis major, you're on that pectoralis minor fascia. However, we do want to get specific. If I have my scientific be precise hat on, then we want to get to these 3 slips that go from the 5th rib and the 4th rib and the 3rd rib. When you go underneath the pectoralis major in search of the pectoralis minor, you want your hands to go parallel to the ribs, not into the ribs. You're not trying to dig this thing off the ribs, and besides, that hurts, doesn't it?
Yeah.
Yeah. Mm-hmm. So you wouldn't like it if I was doing that for several minutes. No. So to get this, this is a very difficult place to reach, but also very rewarding, and many, many people have this fascia held short, bringing the shoulders in around the chest, and so we want to open it up. Now, as we slip our fingers in here, you're bound to encounter that muscle, and you will encounter it when you have reached the line between the outside edge of the rectus abdominis and the coracoid process. If you're not crossing that line, you're probably not on this muscle. So as I come in here, I'm looking for that muscle, and in most muscular people, such as Stefan here, I find a distinct pectoralis minor muscle. In some people, especially the older people, it might be fastened down to the ribs here, and so I might have to look closer to the ribs. On some others, especially those women who've had breast surgery, either for cancer or breast augmentation, sometimes the pectoralis minor is glued against the back of the pectoralis major. So you may have to look around to find this muscle. If you want to find it, just have your model lift their shoulder up. So just lift your shoulder up, not the hand, the shoulder. Lift the shoulder off nope, that's your ribs. Just lift the shoulder towards the opposite hip. There you go. And I will feel the pectoralis minor under my hand come alive. So a better way to reach this than coming from here, if you want to come right along the ribs, is to get down on the floor and have the heel of your hand on the table. So then your fingers really conform to the ribs. And with a soft hand, you can come right around and find this pectoralis minor. I can use my other hand to gather in the tissue and make sure that I have the pectoralis minor right here. And now, Stefan, you can breathe. That's one motion. So just him breathing opens up this tissue. I can help that along by going from the rib attachments towards the coracoid process. Yep. Now, that's if this is restricting the breathing. If the arm is restricted in lifting, such as reaching up to a shelf or something like that, I can hold this muscle, work out towards the coracoid process. As you lift your hand towards the top of your head, just slide along the table. Yep. And so he stretches the fascia and the muscle out with me, and I just traverse along it as he goes. Yeah, you can feel that one. It's pretty burny, huh?
Yeah, it's burning.
Okay. We won't go any harder on that. There is another motion that you want to use with this. If you remember when we were talking about the scapular X, we said that there was an inverse relationship between the trapezius and the pectoralis minor. So if I bring his arm down this way, and then I bring my hand under his arm, and once again sliding with a soft hand along the ribs into the pectoralis minor, and while opening that muscle, I say to Stefan, now bring your shoulder blades down and together in the back. Now see if you can do that without lifting your tummy up in the air. Without lifting your tummy in the air. Just bringing the shoulder blades down and together in the back. Good. So this is like a military posture, bringing the shoulders down and back, or it's the same thing that they use in Shavasana in yoga, bringing that down and back. So this technique probably takes longer to do in practice than we've taken here, because you want to be very sensitive, very careful in doing it. But the rewards are great if you can get this tissue to open. We have one other technique we'd like to show to get this, and that's on the side. Another way of approaching the pectoralis minor is from the side, and we have Ellen here to help us show that. I don't like this method as much in terms of its effect on the muscle because of the way the client's positioned. However, it does have the advantage of allowing lymphoid tissue, which is a nice safe way of saying breasts, to, actually a scientific way of saying breasts, to fall away. So in this way I can slide in along the underside of the pectoralis major, again, not digging into the ribs. This really hurts, yes? Mm-hmm. Yeah, you don't like that if I'm coming into the ribs. So always go along the ribs, and here, not very far in, very clear, is the pectoralis minor muscle. Now often I'll want to slip underneath it to start making a move, and I'm just going to fold, now that I'm there, I'm just going to fold her arm down, put my hand on the top of the shoulder, and that way I can begin to work with this muscle. With my hands this way, do you see how my elbows are moving? This allows me, that's it. Now you just drop your shoulder blade down your back, Shavasana style. That's it. And we can begin to work in here. How about you take a deep breath? Good. Okay, so how's that feeling? Is that
fine?
Not too much of a challenge?
Mm-mm.
All right. So if that's the outside edge of the muscle, if I were to go further into the muscle, how's that for a challenge?
Okay.
Still okay?
Mm-hmm.
And if I were to go even farther in?
Starts to hurt.
Yeah, so having found that, I'm just going to back off till I'm at her hedonic point, the edge between pleasure and pain, and we'll work with her breathing, we'll work with her shoulder movement, and if we want to, she can lift her arm up as if you were reaching up for a shelf, something on the shelf. And that allows me to work with this muscle and its associated fascia with her range. Okay, and the next structure down in the deep front arm line is the upper arm muscles, the biceps on the top, coracobrachialis underneath, and the brachialis underneath the lower part of the upper arm. First one we're going to do is the coracobrachialis. This you can find coming down from the coracoid process in the armpit. If you put your fingers just under, using the pectoralis major as a guide, just put your fingers right under there, and then bring the arm down over your fingers. So now your fingers are in the armpit, and you can press your finger pads and fingertips out against the humerus. Now, you have to be careful here because remember we had the intermuscular septum. That should be about under your fourth finger now, your ring finger. Here, I'm going to open that up so you can see that again. So about under your ring finger is the septum, and the nerve bundle comes with the septum here. So we want to be just in front of, just anterior to that septum, and you will find a muscle which is often stringy in a lot of people because it doesn't get used. And if you now pull your hand against my hand, pull your hand to your body, toward your body. Yeah. That's it. Then you feel the coracobrachialis contract. It's an adductor of the arm. And when you see the elbow held against the body, that would be a good sign for you that this myofascial structure needs some work. So I just hook this and bring it down and out. Again, I'm going to open it up so the camera can see this, although I don't do it this way. I'm just hooking this muscle and bringing the tissue down and out, but I do so with the arm here. So the motion that you can use with this, Stefan, is to take your elbow out and in. Back in again. Yep. I would say a half an inch, but he thinks in millimeters. So 2 millimeters out, 2 millimeters in. Good. Yep. All right. And I'm just bringing that tissue down and out. If your client feels nervy when you're doing this, you're pressing on the nerves, cease and desist, move a little bit forward, and you'll find that coracobrachialis. You can also approach the coracobrachialis from a sitting position. So we've put Stefan on the bench. I'm going to place my hand so that the back of my hand is up against his armpit and my fingertips point out, and then drape his arm over my hand. Now if I bring my fingers out against the arm, I may find something nervy. Does it feel nervy in there?
Not yet.
Not yet. Okay, so now press your hand against the bench, and when he presses his hand against the bench, I feel, or against the side of his body, I feel that coracobrachialis get hard. So now relax, and I can hook with my fingers. Just hook like that with your fingers against the coracobrachialis and bring it out, and I'm going to invite you to slide your hand down the bench. Not to bend your back, just to slide from the shoulder. That's it. So you feel that?
Mm-hmm.
And if I can, I'm going to slide in under the head of the humerus, bring it out from the body, and then just drape the shoulder down over the rib cage. Once again, up under the head of the humerus, bring it out from the body, and then drape it down. Do be careful of the nerves. If somebody's getting tingling down their arm, you have to cease and desist. The coracobrachialis is in front of those nerves, so if you find the nerves, you know where you ought to be, just a little bit in front of that. And this is a great motion for letting the arm down onto the rib cage, letting the shoulder down onto the rib cage. And the next structure down in this deep front arm line is the biceps. And although I can't say that I work the biceps a great deal, because life usually works the biceps quite a bit. If the biceps is short, if you have a baseball player or something like that in your practice, then you can find it obviously. I think you know where the biceps is running. So you catch the belly of the biceps, passively shorten it by lifting the arm up, and then slowly, I'm going to ask Stefan to slowly lower his arm back to the table. So he's using the biceps in eccentric contraction, and I'm going along right at the rate that he's opening. He's doing it nice and slow, which is what I want, a nice and slow opening of the fascia of this muscle. Now, the biceps, you can open it all the way down to the elbow. Don't press too hard in the cubital fossa, obviously. And you can do this a couple of times of just letting the arm, letting the elbow open up as you go down the biceps. This is for opening up the fascial layer of the biceps. You might find trigger points or other things that you want to work in here, but this very simple technique will allow you to open up biceps if it needs it. And if you do the bicep, don't neglect the brachialis, the muscle that lies underneath it, especially if you've got somebody with a flexed elbow, chronically flexed elbow, or elbow problems. You'll really want to open the brachialis, which is the large but forgotten muscle underneath the biceps. So to get to the brachialis, you're going to go on either side of the biceps tendon. So here's the biceps tendon, and you're going to go right around it and pin the muscle that's underneath it. Now, having showed you that, it's a lot easier to do with the hand flex. So flex the client's hands with the palm facing towards their head, and go around that biceps tendon and pin the muscle against the humerus with 2 fingertips, and you can reinforce that with another 2 fingertips if you need to. And now I just say, Stefan, could you open up your elbow, letting the hand come down? That's it. So this is not that hard. The hardest thing about it is to find the muscle, and he does the work. Hey, he does the work and I get paid. This is great. And he opens up the hand all the way to the table, because the more he gets into full elbow extension, the more stretch you'll get out of the brachialis and the brachialis fascia. Now you can see that my fingers are going up and wide, but really only a little bit, only an inch, starting from right under the biceps tendon near the elbow, and as he opens up, letting that go. If you feel, you're not feeling nervy, are you?
No, no.
Tingling in your fingers or anything?
No.
Yep, that way I just make sure that I'm avoiding the nerves, but opening this part of the brachialis up near the joint. I'm taking my fingers out of the way so you can see. And he does the work by opening up the elbow to full extension. In the lower arm, the deep front arm line travels along the edge of the radius bone. And it's really hard to find here with the biceps tendon. It disappears in the meat, but it comes out here. I've got my fingers on the radius bone. And in the event that you have somebody who has radial deviation, where the hand is turned in, where the wrist is turned in towards the thumb, then you'll want to use this technique. It's relatively rare, but here it is. If you want to open up the base of the thumb because the thumb is pulled in towards the hand, you get 2 fingers on either side of that radius bone, and then just, we don't use words like scrape, but scrape down along the bone and open up that tissue on either side of the radius bone. Now you notice that I've got his hand off the edge of the table. So Stefan, take your little finger closer to the table. Bend at the wrist. I'm sorry, closer to the floor. Take your wrist and bend the hand open. That's it. You feel that opening along the base of your thumb?
Yeah.
Yeah. So here I get along the edge of the bone, and the closer you can get to the bone, the more effective this technique is. And just bring your fingertips right along the edge of the bone. Shouldn't be painful. It isn't painful, is it? No. Okay, good. And now bring your hand up again, so your thumb is close to the ceiling. And then bring the little finger down to the floor. So the client helps by opening up that tissue as you bring it down towards the base of the thumb. It's rare that you need to use this technique, but it's nice to have if you need it. The last element in this deep front arm line is the thenar muscles that hold the thumb. And in those people who overwork with the thumbs, or for some reason have the thumb pulled in, this can be a good place to work. Now, you remember that we did the widening of the flexor retinaculum over the carpal tunnel. This is similar, but we're going to run along these muscles that go for the thumb. And the idea generally with people who have these muscles too short, which Stefan doesn't qualify, he doesn't really need this technique, but if you strum in here and can create some soreness in those muscles, then probably these need work. So I'm going to take several knuckles here, put them on the muscles, and then ask Stefan to open up his thumb really wide. Really take your thumb that away. So, yeah. It's okay?
Mm-hmm.
And do it again. We're not quite done. And the idea here is either going out along these muscles, or with people with the thumb really rolled in, you'll find it useful to modify the technique to roll the thumb out away from the rest of the hand. So you can see that I'm putting quite a bit of pressure on here. How are you doing, Stefan?
Fine.
It's fine? Not so bad? Okay. We're just either rolling the muscles, the thumb off the hand that way, or indeed going along the muscles from the base of those thenar muscles out towards the thumb. Okay, that takes us through the deep front arm line. Let's get started on the superficial back arm line. So the superficial back arm line starts with the trapezius, continues with the deltoid and the lateral intermuscular septum, down to the lateral epicondyle, and down the backside of the forearm to the backsides of the fingers. The first muscle in the superficial back arm line is the big wide triangular trapezius, which goes all the way over to the scapula, as you know. I want to draw your attention, though, to this leading edge that goes from the occiput down and forward to the collarbone. So we're going to catch that leading edge and bring it back. So I'm going to put my hand on the main part of the trapezius back between the shoulder blade. My forward hand catches that leading edge of the wave, and then I'm going to take my elbows in orbit around Jeremy's shoulder as I peel that trapezius off the front of the shoulder and put it on the back of the shoulder where it belongs. You can do this several times, and it involves a nice big surface of my hand. Let me show you on this side so that you can see what happens to the leading hand. I just take my surface of the back of my hand, catch that leading edge of the trapezius, and roll it around his body. Now, Jeremy, you can bring your shoulder blade down and together and let your head float up off your body while I'm doing this. In this way, you can really ease the trapezius and settle the shoulder down on the back. Another way to approach the trapezius on the table instead of on the bench would be to put a nice big surface of your hand on the trap just proximal to the scapula, and another one, again, a nice big surface on the leading edge of the trapezius, and to roll that trapezius around the body. Now, Jeremy, just bring your shoulder blade down and together in the back. That's it. And you just roll this around. I'd like you to notice that my elbows are doing the moving. If you try to stand still and do this with your hands, you'll be very tired by the end of the day. Just get a nice big grip on that thin sheet of trapezius, and then your body rolls your elbows, and your elbows move your hands. That way, it's least effort and the most effect. Okay, as we said earlier in the tape, the lower part of the trapezius is rarely too tight and often not sufficiently toned. So let's just put an exercise in here to tone the lower part of the trapezius and actually the upper part of the lat too. This will help strengthen the muscle in the back with people who have a kyphotic back, and also to open up the corresponding muscle to help open up the pectoralis minor with its corresponding antagonist, the lower trap. So, Jeremy, I'm going to have you lift your shoulders right off the table and your head as well, so you can look straight ahead. That's it. And lower. Good. And lift. And when he does that, he has to strengthen this lower trap muscle. So now I'm going to refine it a little. You lift your shoulders, but not your chest. Leave your breastbone on. There you go. And bring that down. So although the other exercise was using the lower trap, this specifies the lower trap, because again, nothing else brings these scapulae down and in except this lower trap in here, which we want to increase that tone. So come on up, bringing that muscle down. Okay. Now, obviously you have to repeat it more often than we're doing on the tape, but that's the idea. So the next structure in this superficial back arm line is the deltoid, and side lying is the best way to get to the deltoid. I'm going to do two things. I'm going to take Jeremy's head, I'm going to take the client's head and elongate it right along the line of the body, and then I'm going to take his arm and lay it so the back of his wrist, his watch face, so to speak, is on his hip, and his elbow is pointing up. And I'm going to put my hands on either side of the deltoid, the anterior and the posterior part of the deltoid, and lining myself up, I'm going to go right down that deltoid with my fingers into it. Is that okay, Jeremy?
Yeah, that's fine.
That's fine. Okay, so now take your elbow up to the ceiling, half an inch or so, and down. And up, and down. Now you can go anywhere in the deltoid here, opening it up all the way from the acromion and the collarbone, right down the muscle towards the tubercle, although you'll get your best effects from the upper, earlier part of the muscle in this case. But opening that up, but don't forget to move, Jeremy, up and down, up and down. That's great. So we can just move this tissue off the shoulder, ease up that tension in the deltoid, and get it to relax. In working down the arm from the deltoid, our next port of call is this lateral intermuscular septum. Like the technique that we did for radial deviation of the thumb, it's very rare that you need to get in here, but some people with tennis elbow or other kinds of elbow dysfunction, you'll want to find the lateral epicondyle of the humerus, proximal to that, and you will find another little guitar string. This one is generally softer and not quite as long as the other, but you can, in cases where people are overusing the arm, get some joy out of bringing this down away from the shoulder towards the epicondyle, right up onto it. I'm using my my middle finger, but you could use a knuckle or an index finger. Doesn't matter what tool you apply, the idea is to find this string and to move it towards the attachment here. The attachment of what? The common extensor tendon. Just as we found the flexor tendon on the other side, this is the extensor tendon, and we can move down this set of muscles here, again with a fairly wide, if you see what I'm doing with my fingertips here, I've got a fairly wide band. You can warm it up with the back of your hand, but you can be a lot more specific with your fingers, coming right off the medial epicondyle onto these tendons. And I'm going to ask Jeremy to lift his hand towards the ceiling, lift his fingertips towards the ceiling, yep, and come back down. And then press your fingertips into the table, and then lift your hand again. And I just want you to notice how slowly I'm moving. This is tough tissue in these extensors. That's it. And Jeremy's just keeping the motion up as I go up and down here. Now, somewhere around where his watch would be, I'm going to run out of muscle and just be in tendon land. And there's not much that I'm really going to do with the tendons here. You can continue the technique down, but I've found my most effective area is up here near the common extensor tendon. So you can apply this several times, and once again there are superficial and deep muscles, and you can either be more narrow or a little more wide on the forearm, and the more somebody uses their forearms, the more you can repeat techniques like this. Even if they work in flexion, you'll need to be working the extensors. Even if their job or their music or whatever has them working in flexion, don't neglect these extensors. A really nice way to put all these techniques together is with this technique for the superficial back line. Right here in front of the deltoid, in the anterior part of the deltoid, goes your inner hand. Your outer hand from outside your body goes right down, just distal, just south of the humeral epicondyle, and we're going to go down. Now the upper arm and the lower arm are about the same length, so we're going to go at the same rate down what is now the front of the arm, but is actually the superficial back arm line. At the same time we're doing this, we're going to ask Jeremy to take his elbow out away from the body and come back in. And out away and come back in. And out away and come back in. And if I'm doing it right, I should arrive at the wrist and the elbow at about the same time, and that is a really good technique for organizing this whole line. The only thing you want to make sure of here is you have the arm organized so that the elbow is facing more or less out. Not so the elbow's on the table that way, but turn the arm so the elbow's facing out, and then when they take the elbow out away and then back in, this will work out pretty well. So the deep back arm line starts from the spinous processes, go down on the rhomboid and then out on the rotator cuff, down on the triceps to the elbow, and down on the ulna side of the arm to the little finger. The first track of this deep back arm line is the rhomboids and the levator scapulae. And although we'll show you stuff for doing this on the table, they're very accessible from a sitting position on a bench like this. So if I ask Jeremy to just lean forward a little bit and put his hands on his thighs or his knees, that presents the rhomboids for easy working. And if I just put the flat of my lower arm on here, I can simply spread the rhomboids wide. What I'm doing here, just to show you with my fingers, is spreading along the rhomboids and the levator here. I can do it with the point of my elbow if I want to be more pointed, but usually the flat of the elbow is nicer for the client and moves that whole sheet of fascia out. Since people who have rhomboids that are too tight often have a spine buried in here too, have a flat thoracic spine, you're kind of getting both issues with one move here because you're kind of unburying the spine by lifting this tissue off the back. You'll also find other techniques for the rhomboids on the spiral line program. Okay, as well as getting to the rhomboids on the bench, you can do so on the table, but my hand's going to be out of sight, so let me show you how this works. To get there, slide your hand under the shoulder and lift it up a little bit. Reach under with your hand and put your fingers at the top of the shoulder blade, between the shoulder blade and the spine. Then hook your fingers and use the other hand to roll the shoulder down over your hand, and then hooking the tissue of the trapezius and the rhomboids, bring it down along the edge of the shoulder blade. So let me show you how that looks from underneath. If I put my hand under here, right at the top of the shoulder blade, between the shoulder blade and the spine, I just hook my fingers onto that tissue and come down in between the spine and the shoulder blade. So let me show you one more time. This hand is essential. This hand rolls the shoulder blade down into place, while this hand brings the tissue down the back, straight towards the sacrum. This is a really nice move for helping to position the shoulder properly. Feels pretty good, doesn't it, Jeremy?
Feels great.
Okay, great. So moving out from the rhomboids on this deep back arm line, we go into the scapula itself and the rotator cuff, which is a kind of sandwich around the scapula that controls the head of the humerus in the same way that the body controls the eye. It turns the head of the humerus like the head turns the eye. Now, three of these muscles of the, they're muscles and fascia together. These myofascial units on the rotator cuff are located on the back of the scapula, and so that's what we'll do now. Supraspinatus, infraspinatus, and teres minor. And then we'll reach the subscapularis in different ways. So, starting with the supraspinatus, this, if you find the spine of the scapula, which is a nice big prominent bone here, obviously the supraspinatus is going to be above it. Now, what's not so obvious about the supraspinatus, two things. One is it's an abductor of the arm, and therefore it helps the deltoid abduct and is often absent without leave when you have deltoid bursitis. So waking it up is a great idea in people with that kind of bursa problem. But the second thing about this is this muscle goes really deep. So Jeremy, how's that? Is that okay?
Yeah.
All right. And if I added more pressure to that, is that still okay? All right. So I just work with the client to get the proper amount of pressure here, and then I work along the edge of the spine of the scapula. Is right there, and I'm just working along the upper edge of that. Now, after a while, you hit the acromion and you can't follow the supraspinatus out anymore, but you can really get in deeply between here and there. And I use my fingertips, I use my thumb, I use my knuckle, anything that I can use to get in there deeply. Is that too much now, Jeremy?
No.
No? Okay, but you'll tell me if it's too much, won't you? If you come off the table, I'll know that it's too much. All right. Just going along so slowly, allowing that tissue time to open and wake up and otherwise get active. Next on our list for the rotator cuff is the infraspinatus, and like the name implies, it's just below the spine of the scapula, goes down to about here. Two things about this. One is it's a major lateral rotator of the humerus. So if somebody comes in with that lateral rotation as a posture, or trouble medially rotating, you might want to open this up. Secondly, it's covered with a pretty tough fascial covering, so usually a few fingertips are not enough to do this. I'm going to show you with the fingertips first, though, just so you can see exactly where this muscle runs. Find the spine of the scapula, about 2 or 3 inches below that. I usually start up near the spine and work out from the origin towards the insertion. And I usually do this in 2 or 3 runs, and I'm going way too fast here just to show you. The actual technique that I tend to use would be to use knuckles, get on top of your hand, and just as in the case of the pectoralis major, fall through this tissue. All right? So that's for the tissue, but now what do we want him to do? Press your hand, Jeremy, down towards my leg. See what he's doing? He's medially rotating the humerus. Okay, and relax. And again, press down. So he's stretching out this muscle, so he's helping me to open actually I'm helping him, to open that tissue along this surface out to the humerus. Next on our list for these little rotator cuff muscles is a very small but very important little pivot point, and that is the teres minor. For a down and dirty way of finding it, if you find the acromion process and you find the fold in the armpit and you go about halfway in between and strum, you'll probably find something about the size of a little finger or a pencil coming across from the lateral border of the scapula. That little awful thing right there, yeah? You feel that? Okay. So this is a very good opportunity for a pin and stretch technique. So I'm going to make sure you have this little thing here. You're not up on the infraspinatus, you're not way down on the teres major, you're right here in between on the teres minor. You pin that against the scapula. It's a slippery little devil, so it's a little bit hard. All right, Jeremy, now take your hand off the table and you're going to reach out like this. But as you reach out, you're going to turn your arm medially. You're going to turn your thumb up. Great. All right, let's see if we can make that a smoother motion. Start out here, and as you reach up, you turn the hand over. Okay? The trouble is, I'm going to be holding on to this. So just go quite slowly. Yep, there you go. So you reach up and turning the hand over into a medial rotation. Now, we never say oops, we always say there. I slipped off of it, so come on back. And I'm going to, this time, since his is so strong, I'm going to use a knuckle. Okay, off you go. Moving slowly. Let your shoulder rest on the table. And turn that arm in. Ah, we got it that time. You feel that?
Yeah, for sure.
Yeah. What's the feeling on that for the folks back home?
Kind of like a warm stretch.
A warm stretch. I think he's being English and understated. It can often be really, really quite a bit of sensation in there, to use the English phrase. Right there. Okay? The last of these rotator cuff muscles, and sometimes the most difficult, is the subscapularis, which is on the front of the scapula. So to reach it, we're going to once again come into the armpit. This is an axillary technique. If you put your fingers in between the latissimus before and the ribs above, again, we do not want to press on the ribs. We want to go between the ribs and the latissimus. And if we continue that on, where we are is between the serratus anterior on the fingernail side and the subscapularis on the finger pad side. And the fascia between the two of them often gets stuck together. So our first move would be to saw, we don't use words like saw, melt the fascia between the serratus anterior and the subscapularis. Now, I've got the arm open so you can see where I am, but you'll actually find it easier to do this technique if you fold the arm over your hand and slide in up there. Now, to feel the subscapularis, I'm actually going to take the arm out of here. The subscapularis is a medial rotator, so if you pull against my hand, try to put your hand on your tummy, you can feel that subscapularis under your fingertips. So that's using this medial rotation. And likewise, if I want to get him to relax, now push out against my hand. Yep, that gets me to relax. That gets Jeremy to relax the subscapularis, and I can get up in there. Getting up in there is not an easy thing. This is something that could bear repeating with several different sessions, just slowly getting in there. And be careful not to overwork this because it can get really sore. Okay, so continuing on down the arm from the rotator cuff, our next port of call is the triceps. And to get the triceps, which often need more tone rather than less tone, but what that means is the fascia that's right along the bone is really tight. So if you take the hand and put it such that the hand is next to the ear, and Jeremy, your thought during this is to keep the scapula on your back, keep it from crawling up your arm. And I am going to go right in at the olecranon where the triceps comes and taking a nice broad stroke with all 6 fingers so that I get all 3 heads of the triceps. Unfortunately for Jeremy, my idea is to stay pretty close to the bone as I work my way down here. What I notice is that my shoulders are creeping up to my ears, so I'm going to get up on my tippy toes and come down on this that away. How are you doing, Jeremy? Is that all right?
Yeah, that's fine.
Okay. Not too much of a challenge on your wrist?
Comfortable.
Yeah. Some clients will not be able to put their wrist like this, in which case you can't do this technique this way. But most athletic ones can, and you can track this right down the arm towards the armpit, although I usually stop just short of the armpit skin because it's a little bit dicey. Okay. From the triceps, this deep back arm line goes down the edge of the ulna from the olecranon to this styloid process in the wrist. There is fascia covering this, and there are extensor and flexor carpi ulnaris muscles on either side. When you see the hand deviated this way, which we do right now in Jeremy, it's very common with massage therapists to have the hand turned that way. Anybody who's doing a lot of hand work, it's something to look at. If the hand lies this way, you might want to use this technique to come down along here to open the hand that way. So, get 2 fingers on either side of the ulna, going in fairly deep, and slide down along the ulna, either side of it. I've got the bone right between my 2 fingertips. And Jeremy, bring your hand closer to your thigh. Stretch it in, and then relax. Stretch it in, and then relax. Stretch it in, and then relax. If you can't get enough pressure with your fingers, you might want to use knuckles for this. And turning them like that, really go down here with more pressure. Is that more pressure for you?
That's about the same.
About the same? Okay. Now move that hand in towards your thigh and away. And towards your thigh and away. Either way, what you want to do is get along this bone and move the tissue down towards the hand as they move the wrist. So if you're of a mind to, the last part of this is the hypothenar muscles at the base of the little finger. And these muscles, like those at the thumb, if you just take your fist and grip around these muscles, you can open them up. So if you just get your fingertips right on the base of these thenar muscles and roll them out. This can be helpful if the little finger is problematic, but once again, this is not a technique that I use that often, just when the hand needs opening. It's a great one, however, for violinists. So there you are, with thanks to Jeremy, Ellen, and Stefan, with a number of techniques for the shoulders and arms organized into their fascial connections. In practice, I actually put these techniques together, mix and match, to construct a session for the shoulders and arms. One final note. The fact is that arms work pretty well. Unless you've got somebody with overuse or abuse by injury, or maybe a musician who really uses their arms a lot, the arms are likely, any problems in the arms are likely to be due to the fact that the rib cage or the spine is not set to support the shoulders and arms. So make sure you have that right before you do too much arm work. We hope you enjoyed the program, and we really wish you the best of luck and skill in your work.